Chet Holmgren had to be helped off the court after this really hard fall early on in tonight's Thunder game, and in this video we're going to talk about what exactly happened here and what the injuries could be. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in this channel is to teach you more about the medical side of the sports world. We've had a big rash of NBA injuries recently. We had, of course, Ja Morant with his hip partial subluxation. We've got Kevin Durant out with a calf strain. These kind of small, innocuous looking injuries that didn't really seem too bad or serious in the moment, but unfortunately this evening we saw another injury happen with Chet. So, of course, as Chet is going off the court, he doesn't want to seem to put any weight on that right side, but thankfully, this doesn't look like anything overly concerning for Holmgren. I think worst case scenario, we're talking about some type of hip pointer or severe bone contusion, bone microfracture, but I don't think this is anything like joint, ligament, tendon, that sort of an injury pattern. So what exactly happens here? Well, of course, Holmgren gets up high in the air, and as he comes down, his body gets sideways. You know, it's always scary in these situations. This is what we call a foosh mechanism, a fall on an outstretched hand, where we see things like scaphoid wrist fractures or distal radius fractures from all that load coming down, landing on his right hand like that. So he's actually fortunate that we at least don't seem to hear about any sort of a wrist or even an elbow or radial head, radial neck fracture because of this type of a foosh mechanism. You're coming down from a really high elevation. That is a way that you can certainly fracture your wrist, fracture your elbow. But the weight doesn't get distributed directly into the wrist or the elbow. He's able to kind of flex, use it to just buffer his fall a little bit. But then as he comes down, he just lands square flush on the outside of his hip. So looking at our biodigital anatomy tool, I've essentially just shown all of the muscles and the bones that we're going to be dealing with here. And we're going to actually just get rid of the upper limb. We don't really need to see those. We're going to focus on the lower limb. So just to kind of get rid of everything here, we're going to hide those that we don't have to see them anymore. So now we're focusing on the lateral or the outer portion of the hip. When we talk about medical terminology, lateral is going to be the outside. So the outside of your hip is the lateral hip. Medial is inside, so medial is going to be like the thigh, the groin muscles. But lateral hip is where all of that load, all of that blow comes down with Holmgren. We, of course, know Holmgren's not the most strong, bulky, big guy, and that means there's not as much muscle padding to protect the bones and protect the underlying osseous or bony tissue whenever you have a fall like this. The first thing we're going to have as we work our way from outside in is going to be the IT band. The iliotibial band comes off of a muscle called the tensor fasciae lata. It's this big long band of connective tissue that runs down the outside of the leg. Not necessarily anything that I'd be severely worried about having an injury here. The next muscles that we get to, this right here is that TFL, that tensor fasciae lata. That's going to be part of that origin of the IT band. And then the next things we get to are going to be the gluteal muscles. So gluteus maximus, big muscle, buttock muscle. If we get rid of that, then the two hip abductors that whenever they fire are going to lift or abduct the leg out to the side are going to be the gluteus medius and the gluteus minimus. So these are two muscles that sit on the outside of the hip. They originate up on a part of the pelvis called the iliac crest, and then they travel down onto the femur and insert onto this prominence, this bony prominence called the greater trochanter. And we're going to uncover some of these other muscles that aren't as relevant so that you can see that underlying bony anatomy here. So this is going to be that bony prominence of the greater trochanter that's very exposed whenever you land directly on the outside of your hip. There's not, again, a lot of muscle overlying it, and so you can have significant bone bruising, microfractures, trauma to this bony prominence, the greater trochanter of the femur, whenever you have a fall like we saw with Holmgren. The other thing that sits higher up, people talked about, looked like maybe he's grabbing near his oblique. That's not necessarily going to be the case here. You're not going to have an oblique strain from falling on the outside of your hip. And those oblique ab muscles are going to be higher up and in enough that you're not directly landing on them to cause significant tearing. So I would not be as concerned about the obliques. However, if we hide the oblique muscles, then this next bony prominence we're going to see is that iliac crest. The iliac crest is the top part of the pelvis. You can feel it very easily on yourself, especially in the front. This front bony prominence is called the ASIS, anterior superior iliac spine. The anterior inferior iliac spine is going to be right down here. So AIIS, ASIS. These are going to be, especially this ASIS, a bony prominence that you can certainly land on. Landing on this iliac crest, a hip pointer is an injury where you have essentially microfracture, bone bruising of this iliac crest from usually a football hit or just a direct fall on the outside of your leg. Now, if we go back to this play, the reason that I'm not worried about a big like joint injury like we saw with Ja Morant is because there's no load going through Holmgren's hip joint. If he would have landed from this position straight down onto that straight right leg, then yes, you get a lot of load that's going to be transferred in this axial direction up into the hip joint, potentially causing a bad hip injury like we saw with Morant. But whenever there's not a lot of load being imparted through a joint, there's a low chance of that joint being injured. So in this position, his hip joint is well protected deep inside there. There's no axial load going through the femur up into the hip joint. He's not trying to put a lot of load on the muscle as he's activating it, so I wouldn't be worried about anything like a muscle strain either. So I don't think that's why, this is why I'm not as worried about a more significant injury, something like we're seeing going on with Ja Morant, or something that's going to be a longer absence. Now, just a hip pointer, a bad bone bruise can be very painful, can be a few week recovery potentially, but that is the best case scenario when you see such a hard fall like this. So reviewing our anatomy again, thinking about all this, those glute muscles, we can see glute max, glute med, glute min, abductors are going to be on the outside of the hip. And then we've got that iliac crest, the bony pelvis that wraps around. Greater trochanter is this bony prominence of the femur that you can feel in the lateral portion of the hip. As he goes down to the ground, lands on that right side of the hip, probably causing deep bruising, potentially bleeding within those muscles, deep bruising, potentially microfracture, trauma to the bone itself, just from the direct impact of landing on the floor. When you're trying to walk, you're going to be activating all of these muscles. And so that's why it's going to hurt. That's why he's not going to be able to put weight on it, because to walk, to stabilize your pelvis, you have to fire these gluteal muscles. And so if they're severely bruised or contused, you're not going to be able to do that because of the severe amount of pain. So just the fact that he couldn't put weight on it honestly fits because of how much the bone was probably bruised or these muscles themselves were bruised. So in summary, I don't foresee this, just from what we saw so far, of being a real big serious thing. In fact, I think there's a chance he even comes back later in this game. I'm recording this still in the first half, and so it wouldn't shock me if we even saw him come back maybe after the first half is over. But I would not expect a real lengthy absence, and if there was, I would think more so on the order of just days to weeks rather than like weeks to months. That's it for the video. Thank you as always for watching. Let me know any questions or comments down below. And until next time, we'll see you later. Bye.